The code to winning. Insights you need today to seize the world tomorrow. Today we have a very, very special guest, somebody I've been looking forward to interview for the past 2 months. I'll give you a brief introduction of who we have, just her accolades, accomplishments, and credentials too. Jillian Brooke. She is the founder and owner of Snatched Medical Spa, Snatched Injection Academy. She was named one of top 100 injectors in America in 2023 and 2024. And her work is regularly featured in the top 100 Injectors of America publications. Jillian is a nationally known allergen aesthetic speaker and expert trainer. She is frequently featured alongside celebrity dermatologists and the nation's top plastic surgeons because of her groundbreaking non-surgical jawline treatment. She originated the signature Snatched Jawline technique using her years of experience and expertise as a wound care specialist. Jillian also patented her Snatched Jawline injection technique and post-care protocol, which provides maximum jawline slimming, skin healing, and non-surgical skin tightening for best outcomes of Kybella. Ladies and gentlemen, great honor, pleasure to have our guest today, Jillian Brooke.
Thank you so much for having me.
Thank you very much. I really appreciate the time you took to join us today in our studio here in North Salt Lake. So, like I told you earlier before we kind of got to know each other, I'm originally born and raised in South Africa. I've been here for about like 7 years or so. And I've always been curious to find out more about this specific field of aesthetics, spa, Botox as well. So before we actually begin, I want to find out a bit more about like who you are, where did you start off, and what made you kind of go into this field of aesthetic?
So I am from Florida, and I went to Jacksonville University and got my nursing degree. And I did home health care for a really long time and really loved taking care of patients and just that caretaker and making clients, feel better about themselves. But I also loved beauty. And so after doing home health care I did that for about 12 years. I just got a little bit burnt out and wanted to change it up. And I was trying to kind of figure out how I could melt the two together where I could, still use my medical degree, but do something in the beauty industry. And whenever I moved to Utah about 7 years ago as well, I took a Botox injection course and completely fell in love with it. I love this. This is my passion. I would do this for free.
Oh, wow.
Yeah. We're begging people come over, let me do your treatments, because it's such an art. So I was able to use, the medical, but also be creative and artistic as well. So, so that's really kind of how it all started. And then after that, I just, engulfed myself more and more and wanted to learn more and do more with it and just continued my education. So. Oh,
I love that. And I think you mentioned you did a course. So in order for you to become like an injector, is there like a prerequisite specifically that is needed for you to become a Botox injector?
Yeah, so you need to be a medical professional. You at least need to be a nurse to take an injection course. And you really need to obviously put a lot of your time into the education because this is not like traditional nursing. It's completely different. So there's a lot to learn. It's really like going back to school to learn, the facial anatomy and products, and it's just a whole nother genre.
Okay.
So yeah, but you at least need to be a medical professional, and then you could take the courses.
And then how long is the course if you were to take it? If somebody had like a nursing degree and they wanted to kind of like do that specific course, how long would that take them?
So like a basic injection course where you learn like Botox and lips is usually like a 2 or 3 day course. At Snatch Medical Spa, we make it a 3 day course.
Okay.
So because there is so much to learn that if you
Okay.
try to, I've seen like the 1-day courses or the online courses, and those make me a little nervous. And that's kind of where you see those results that are like, it's just really important to put the time into learning what you're doing so that your client gets the best outcome. So
Okay.
Yeah.
All right. Another thing I wanted to find out, when you spoke about the course, does state laws like require you to get like a course in a specific state, or does like one course just allow you to end up like injecting in all 50 across the
yeah,
state?
so not necessarily, which is kind of I would say like the scarier part of this. If you're a nurse, you're qualified to do injectables. You can take an online, just to teach yourself how to dilute, the medication and things like that. But you do need a medical director. So a nurse can't this is medicine. So if you're, an RN, you do need a doctor or a nurse practitioner that is overseeing your work, and they are prescribing this to the client.
Okay. I noticed because I looked up your company, and I think there's a doctor, like
Yeah.
the gentleman there, and I think in between them there's another there's another injector as well.
Yes.
Could you like elaborate a bit more on those specific titles, and does each
Yeah.
specific SPAR need to have all three?
No, so the
Okay.
other injectors just were really busy, and I can't take any more clientele right now. And so I hired another injector that's kind of going to be a mini Jillian, and inject the way that I do, and kind of
Awesome.
teaching her my ways so that she can, treat those clients.
Okay.
And then, yes, our medical director, Dr. Barlow, is amazing. So he does all of our like initial client visits and oversees all of our charts, and just like a doctor would do for anything else.
Oh, okay.
So, yeah.
I had a few questions I was very curious about. I've always heard about Botox, and California was, especially like the Los Angeles part of California, used to be like the Mecca. And I think over the past 10 years, Utah's becoming ever so popular, especially in the field of Botox as well. However, there are certain terms I don't fully understand myself. For instance, I want to know what's the difference between Botox, fillers, sculpture. I'm going to get this right, I promise you. Kybella.
Yeah. You did great.
So could you
There's
perhaps...
a lot of differences. And again, this is why taking a course and multiple courses is so important, because there is just so much that you need to know to safely do injectables. I mean, this is clients' faces, right? It's very important that that safety is first. So
Because the only injection I know is the Brazilian butt lift.
yeah,
But I wanted to figure out
that's
what...
a good one too.
I don't
Good
need
one
that.
too.
But, sorry, if you could elaborate on
Yeah.
those ones, because
Yeah. So Botox is going to relax the muscle. So a lot of times we are born with certain areas of our face that we're more expressive. So a lot of, patients might like scowl a little and they have a line here. They raise their brows and they have a lot of the forehead wrinkles. So what Botox does is it relaxes that muscle so that it's not quite as expressive, and it's just relaxed so that you don't create further damage in that area. So we like for our clients to still have some movement. As you can see, like I still have movement, but it just doesn't create the damage, because that is overall what a wrinkle is when that muscle's overworking, and the skin is, folding over and over. It's kind of creating damage underneath the skin.
Okay.
And so in order for your body to heal that, we relax the muscle, and then your body has time to heal from the inside. And that way the wrinkle looks softened or completely is healed.
Okay. Oh, no, I'm glad you mentioned that. The reason why, is Botox like a procedure people go for every single month? Or, are there certain, Botoxes that are required for certain
Yeah.
patients compared to other patients?
So if you do the FDA recommended amount, then Botox should last anywhere from 3 to 4 months. Everyone is different. So we like to see our clients about every 3 months for Botox. And so it's not every month, but it's about once a quarter.
But then after that, is it, done? Or is it one of those?
No. So after that, the Botox will start to wear off.
Okay.
And then you'll come back in for more Botox treatment.
Oh, okay. When does it stop, though?
Yeah. So it just depends on what area we're treating. Sometimes we can kind of like retrain the muscle to not be so expressive and weaken it.
Yeah.
You know, especially like the masseters is a good muscle that like, you know, the first few times you get it, you need to come in every 3 months. And then after that, some clients can now come in every, you know, twice a year or even once a year, just because that muscle is now atrophied some and weakened so that it's not so strong. So the same thing, like we just treat, you know, where needed. And then aging, that's the hardest part is like, yes, we do these treatments, but you're still moving to aging.
Okay.
Right? You're still getting older. So you're still going to need, it's just an onward battle. And so there's no like finish line. It's just maintenance. Kind of like you get your hair highlighted, right? And it's, you know, your hair's going to grow out and then you need to get it highlighted again.
Okay.
That kind of, maybe that analogy can help.
No, that makes perfect sense. So in a way, it's just kind of maintaining it like right through the.
Exactly.
But then the maintenance isn't going to be like as intense as like the actual treatment. So it's probably like once a month. Or can you give a brief timeline of how much the maintenance would be?
So the maintenance for Botox would be every 3 to 4 months.
Okay.
So 3 to 4 times a year.
All right.
Filler is very different than Botox. Filler is going to replace lost volume. So as we age, especially women, because we have menstrual cycles, we lose a lot of bone. And then we also just lose volume because of the natural aging process. So filler is going to go in and restore that lost volume. And so it's not going to do anything to the muscle. It's just going to restore what you've lost. So, and filler is going to last anywhere from 1 year to 2 years, depending on the product and depending on the area. So if it's an area like the cheek area or the chin is going to last longer than if we did lip. Just because we use our lips a lot to talk and eat. And
that makes sense.
Yeah.
Awesome.
So you're going to burn through it a little bit quicker.
No,
so at least with filler, the maintenance isn't so much as like Botox is going to be the one is the most maintenance.
Okay, awesome. Now the next two that I don't know anything about, Sculptra.
Yeah.
What is Sculptra?
So,
am I pronouncing correctly, number one?
Sculptra. Almost.
90%.
Sculptra, you know. So Sculptra is a biostimulator.
Okay.
And it was actually originally founded for like AIDS patients. You know how they lose a lot of volume really fast in their face?
Yeah.
So they found that this product actually stimulates collagen and restores volume. And so, you know, then we took it cosmetically and we're like, oh, we want to use it too. And so that's great for fine lines, wrinkles, restoring lost volume, and it's a natural collagen stimulator. So it's a biostimulator.
Okay. All right. And then I know a lot of the stuff that's been mentioned recently, I've been seeing a lot on your story, is a lot of like the Kybella. If you could explain to perhaps the viewers what Kybella is and what kind of treatment it offers.
So Kybella is actually the same thing that we produce in our gallbladder that breaks down our dietary fat. So it's called deoxycholic acid. So we already have that already. So it's a synthetic form of that in a vial. And we use that for like stubborn small fat areas like the submental area under the chin. And it permanently destroys the fat cell. And with the post-care protocol that we do, also stimulates your natural inflammatory response to tighten your skin and heal fine lines and wrinkles in that area as well.
Okay, awesome. I want to share, not personally for me. So my wife's got a beautiful jawline, right? Yeah. But she's half Russian. My mother-in-law is 100% Russian as well. So if ever I were to do like a plastic surgery, not that I'm saying I would, but if I were, it'll probably be a jawline. Yeah. But I found something very interesting that you mentioned. You said non-surgical. How does the jawline, how does the procedure actually work? Yeah. How could you make me more beautiful than what I am right now?
So, are you asking for yourself right
Personally
now? Or are we
myself.
having a consultation? Or like for your wife, like what I was
Oh, no, she's fine. She's 100% jawline. I need a jawline. Have you seen Matt Rife's jawline is beautiful.
Oh yes. I do a lot of this.
I almost put the rainbow
men.
flag up for
a
that
lot
guy.
of men. Men are just a little more hesitant to to let me post their before and after photos, you know. But we do a lot of men because
Really?
this area, you know, it's a very masculine area. You want a
100%.
chiseled jawline, and you want it to, you know, as we age, we're losing bone, so the chin starts to kind of recede a little. So we want to restore what you're losing. We want you to still be you, but the restored version, right? Like a little enhanced. So doing the Kybella to this area is going to permanently get rid of the unwanted fat pad that we all have under our chin. And as we age, it starts to descend. So it'll kind of pull down on our neck and kind of give us that little turkey neck look that you see like in older people.
Yeah.
So whenever we inject this product into that fat pad, it permanently destroys the fat cell, and then the post-care protocol is going to help tighten your skin. So after that treatment, I see clients back and we kind of assess, do they then need jawline filler, or removing that fat pad, did that, you know, help tighten the area where we see their natural bone structure. So a lot of times clients don't even need filler. They just have the fat pad sitting on top of their natural jawline that's kind of hiding it.
Okay.
So just kind of depends, and everyone is very different with what their needs are. So our treatments are very custom.
Now, the follow-up question, again, it's about me, so unfortunately.
Yeah.
But there isn't like a one-time injection, lifetime warranty where my beautiful jawline can just form. It doesn't work that way, unfortunately.
No, not necessarily. I will say, like, the permanent part of the Snatched Jawline is when you remove that fat pad, you're not going to get it back.
Okay.
Just because the fat cell is completely destroyed and gone. So I've seen clients come back in, they've gained some weight, especially during the COVID years, and they had a great jawline. Like they didn't gain weight here. So that part's the permanent part. The aging process in the neck is still going to be an onward, you know, maintenance. But as far as the fat pad being removed, at least that's just, you know, out of the way. And now we just need to stay up on the bone replacement because we're all going to lose bone as we age.
Awesome. I appreciate that. Now I'll get back to the questions. You know, So I want to figure out the problem I'm also having with, or the misconception is often people feel there are so many side effects that happen when people are taking Botox or lip injections and so forth as well, which leads to the question, what are some of the most common misconceptions about Botox that you could perhaps like clear up today?
Well, I would say you just need to make sure that you do your research on the provider that you decide to go to. You need to make sure that they're qualified. You do get what you pay for a lot of the time. So if you see a deal, $250 lip filler in my basement, I probably wouldn't do that.
Okay.
And I have seen clients come in, and it's really sad because what's happening is some of these nurses are getting their hands on products from other countries for a lot cheaper, but they don't even know what the product is, and they're not FDA approved to use here, and they don't even know like what they're putting in the client, and it's not safe. So we've had a few clients come in where we've had to really try to reverse what was done, and some of it is a filler that's like a silicone, and you can't dissolve that. It has to be surgically removed.
Oh.
Yeah, so it's just really important to know and to ask your provider questions, you know, like what product are we using, and just familiarize yourself with what is FDA approved, what is safe. Do your research, look at the before and afters, make sure that their idea of beauty aligns with your idea of beauty, because we all have a different idea of what beauty is. And so just making sure that you and your provider are on the same page.
Okay. And then with that being said, do you guys often have other skin treatments apart from the injections that people can use, like creams and so forth, that kind of like maintain that as well? Can you talk about that too?
Yeah, it's kind of like, I like to tell my clients, it's like working out and eating healthy. You need to do both, right? It's great to go to the gym, but then if you go home and you're not doing your, you know, what you should be doing at home, then the gym isn't gonna do you as well, right? So same thing with injectables. We like for our clients to do a regimen at home of medical grade skincare products that's going to help their skin. So we usually will give them kind of like a regimen to follow and make sure that it aligns with what their goals are and what we're trying to accomplish overall. And then that does help their Botox last longer and just their overall skin health. Because I think, too, people forget that your skin is the largest organ in your body.
Oh, I never even knew that.
Yeah. So it's the largest organ. It's very important to take care of our skin. And so just the education behind that and why the medical grade skincare products are so important rather than going to, CVS or Walmart or Walgreens or wherever, just getting the cheap, making sure you understand what you're putting on your skin that's being absorbed.
Okay. I love that a lot. And then from the both males and females, what would you say from your clients? What's the most common treatment that both these genders come in for?
Oh, gosh. I think we're the most known for our Snatched Jawline, but definitely Botox and lips. At Snatched Medical Spa, we like to keep our clients looking very natural. So the goal is no one to be able to really tell that they've had any injectables. We want it to be very like, oh, you look really pretty, but they can't really figure out what's different, right? So that's the goal. We want it to be undetectable, just enhanced and restored.
And is that why it's non-surgical, right?
Yeah, so it's non-surgical because a lot of our results, and you've seen probably on my Instagram, they look like they've had surgery. And I've had a lot of clients like, this looks like she's had her jaw.
There's one lady that had a jaw that completely went away and her skin looked way younger and like you could see the before and after.
And you assume like that's got to be surgery.
Exactly.
You can't get that without surgery, and you can, So it's a process. It's not, necessarily a one treatment and you're there. And so understanding that, trust the process and understand that it's going to be gradual. And we want it to be gradual because we want to make sure that we are still keeping you looking like you, just your best self.
Okay. And so for men, it's mainly been the jawline, right? The
Men do a lot of Sculptra and Botox.
Okay.
And then the jawline. So those three would be the top for men. I love Sculptra for men because they start to lose volume here, start to lose like the jawline, and it's a very natural, restorative. You're not going to be overfilled. And it also helps your skin integrity. So it's going to thicken the dermis of your skin. As we age, our skin gets thinner. And so just kind of thickening that dermis where it looks like younger, healthier skin as well.
I actually love these conversations because I didn't even plan on asking those questions. So I appreciate everything you just asked. Now I have to get back to on track as well. I wanted to figure out, I just love going off topic.
Yeah.
But it's not really off topic. I saw recently, the past 2 weeks on your story, there's been a lot of Brazilian butt lift.
Yes.
I can't do this interview without asking about this Brazilian butt lift. Do you think Utah's a market for that, though?
Absolutely.
Okay, all right.
You've been at the gym lately?
No, bro, that's probably why.
You got to wait in line to get on a machine. And usually it's the leg and butt machines.
100%.
Okay,
100%.
like that's important, especially... So as you age, right, we're losing collagen. We start to lose collagen in our 20s. So, and we're losing the collagen in our butt. So we want to replace that. Or maybe we weren't born with much of a gluteus maximus. So we need a little extra help, right? So we have a treatment that can naturally do that. And I love that it's gradual and over time because it's not like one day you don't have a butt and the next it's like, wow. It builds over time. So
the reason I'm asking that, remember, I asked the jawline for me.
Yeah.
But I have a friend in this room right now, right? And he's one of my best friends ever. And the problem, he's got a bit of an ironing board, respectfully. Okay. And we're trying to figure out, do you do BBLs for gentlemen as
Absolutely.
well? Okay. All right, awesome.
Oh, yeah.
I had to put that out there. I don't want to embarrass him or anything.
I love it.
And so, obviously, the technology has improved over time because I think this is becoming a massive trend from the 2008-ish into what we're in right now. And I think with what we've been seeing, a lot of celebrities that were doing BBLs, there was a lot of side effects and a lot of stuff that actually happened. What are side effects that people can perhaps expect that you guys are doing right now to prevent for the surgical BBLs for customers?
So ours is non-surgical,
Yeah.
which is great because we're using the Sculpt Dress. It's a
Okay.
very safe, FDA approved. There hasn't even been any like incidents reported with that product. I would say the biggest concern would be infection, like if someone wasn't keeping the area that was treated clean, which, you know, we follow up close with our clients. We make sure to have them come back in so that we can reassess and make sure that that's, you know, not an issue. We send them home with tangible aftercare, not just, you know, on our website, it's there as well, but sending them home with a post-care to follow and also when to call us. So that way, if there are signs and symptoms of an infection, then we can call them an antibiotic and, you know, treat them for that. So that would really be the greatest risk because this product is so safe.
Okay, awesome. How long have you been doing this?
So I've been doing this for almost 6 years now.
Okay, all right. Yeah. And would you say, considering how saturated the market has been, especially in the state of Utah, what separates you apart from other customers is the non-surgical procedure of how these things are being performed, right?
So I would say that, but also it's such an art. And I do think it's important. That. I think a lot of clients come to me because they like that my results look very natural. And, you know, we've seen the celebrities that scare us, right? We're like, did you see her under eye filler or cheek or lips or whatever that the celebrities are doing where they're way overdone. And, you know, my motto is less is more when it comes to this area, right? So we can always follow up and do a little bit more, but I like to err on the side of less first and kind of baby step into their ultimate goal, but not overdo it initially.
The Winning Store, in collaboration with my podcast, The Code to Winning, I have started a merch store called The Winning Store. We sell high quality merchandise in terms of shirts, sweatshirts, hoodies, caps, phone cases, high quality tumblers as well. The best part about The Winning Store is that we believe in delivering nothing less than excellence. With a keen eye for quality and a passion for style, we curate products that ensure that you always emerge victorious in your fashion game. Are you ready to win? Well, shop right now today at winning.store. Remember, in this game of life, the only way to lose is to stop playing. Here at the Winning Store, we're all about playing to win. So visit us today, winning.store. Get your merchandise today and stay victorious.
Now getting into like the entrepreneurial part of things, what would you say has been the biggest learning curve for you personally as an entrepreneur in this specific market?
Being an entrepreneur it's been in my blood since I was little. I have some funny stories. Like I've always just had like I've shared this one before, but I mean, as young as, I think I was like 5 or 6 years old, a family reunion. My dad loves to tell the story, but I was always just looking for a way to make money. I don't even know what I did with my money back then, but it's like, it's just funny. So we were at a family reunion and I think I just got bored. And so there was an empty table and a water hose nearby. And I went and got some of the plastic cups and started selling water for a nickel. And my dad was like, people were coming over there because you were so cute. You were like, come over here, this water. And it's just straight out of the water hose. But anyway, and then after that,
That's very expensive water.
I used to sell things at school. I'd get in trouble all the time. I'd make like beaded bracelets. They're $1 for my beaded bracelet, and people would want to buy it. And I've got a lot of funny stories. I had a vet club. I wanted to save all the animals. And so I had a little group of my friends that we would put our lunch money together and go to the pet store and buy all these supplies that we were going to open an animal shelter. And so I've always just kind of wanted to do my own thing and find my passion and learn how to make money doing it, right? And to me, that is the code of winning.
100%.
Yeah.
Awesome. Now, I appreciate that. In fact, I love like when people share their stories because sometimes they have very different upbringings, but that often inspire the trajectory of where they're currently heading as well. So I really appreciate you sharing that. Speaking of like entrepreneurship, there may be perhaps like a lady out there that's maybe a bit of an introvert. Would you say your courses, do you offer courses or mentorship?
Oh,
or
absolutely.
Can you talk a bit about
and
that
I
as
will
well?
say that is a big part of this industry. Is you have to understand that when you have a client coming into a medical spa, first of all, they're coming in because they have an insecurity, right? Like they're coming in because there's something that they want to enhance or correct or whatever it might be. And so making sure that that client feels very welcome and I think that's fine if you're being introverted. I think a lot of people can relate to that. I think it's more of being comfortable having one-on-one conversations and being empathetic to whatever that client's concerns are and really listening to that client and hearing them,
I like that.
and what their goals are. Not what your goals are for them, right? Because we all have our own opinions, but really listening to what is concerning to this client.
Okay. Personally, again, for me, the reason I want to try and like make this that way, I'm trying to like put myself in like the shoes of a client as well.
Okay.
I would feel a bit more comfortable if you were to inject me with your 6 years of experience. So with those that do like, I think that 3-day course as well, you don't just get certified, or do you? And then if there's a way, do you like follow a procedure by getting a mentor that teaches you the way? Because if somebody just had 3 days, I would like, please where's Jillian, Brooke?
Yes.
Find her right now. She's doing this jawline, nobody else.
Yeah,
So
I think it's very important to do shadowing. So any injector that I hire at Snatched Medical Spa needs to go through the beginner, intermediate, advanced, and specialty courses.
Okay.
And then they also shadow me for a very long time. So not only to learn the hands-on injectables, but also learn how to do a consultation, how to handle a client that comes in the room and they're crying because their husband left for a younger, cuter girl. Like there are different scenarios that you, as a provider and as a medical professional and a nurse, that you need to know how to handle in a way that's going to make the client feel comfortable and like it's a safe space.
Okay.
So absolutely not just a 3-day course and start injecting on clients.
I feel much better.
Yeah.
Thank you very much for clarifying.
You want to make sure. So my injectors, I'm standing over them for a period of time, watching them, mentoring them, and helping them. And we set up like models to come in so they know that, I use Michaela, my other injector. So she would have like a day where she had, 8 models come in, and then I was standing there. They know that she has taken the courses and she's qualified, but we're just doing the fine tuning now, just making sure. And then, over time, I'm like, okay. And every injector is different. I have some injectors that pick it up really quick and they're good after about 3 months, and others need more like 6, and that's okay. Everyone is different. And I would say, you don't want to rush this. You want to make sure you master the beginner skills before you hurry and do the intermediate skills.
Okay. I like that a lot. And also with entrepreneurship and sales, do you guys have a certain target market? Like, is it models, celebs, young people? I want to try and figure out, is it specific or is it just like general?
Not necessarily.
Okay.
I wouldn't say. I feel like it's your everyday woman. It's hard being a woman. There's a lot of maintenance, more than men, and I feel like there's a lot of pressure on us, especially aging and different things like that. So for me, my target audience is anyone that needs that little boost for themselves,
I like that. I mean, because a woman's beauty is pretty much a lot of their identity as well. And so like maintaining it, and like it's also like a feel good kind of process only for themselves as well. So
yes.
I like that. With the entrepreneurial space, so we know there's a lot of AI that's been incorporated in today's world. We know that social media is actually booming as well. Now, incorporating both social media, AI, are you utilizing those tools to try and enhance your business to the next step and level as well? And if so, how?
Yeah, so we definitely try to use all the social media platforms.
That's how I came across you, by the way. You popped up on my feed.
I love that. There
Let's
she
connect with
is.
Jillian, bro.
I have a great social media manager that she's younger and savvy with all that tech stuff, so she really helps in that area. But I think it's important as an entrepreneur I'm not as savvy with the social media, so hire someone that is smarter and knows it better than you to help you, and that's how you build a great team.
Okay.
Right?
Awesome. What's the best part of your job?
Seeing my clients' faces when they look in the mirror of happiness
love
and
that.
just feeling like themselves again. You know, I have a lot of clients that have been through a lot, and it does wear on you physically, you know, when you go through certain life events, deaths, divorces, you know, any kind of hardships, we kind of start to wear it, right? And we look run down. So to be able to help my clients see their beauty and feel better about themselves, it fills my heart, and I absolutely love it.
Awesome. I like that a lot. And with the 6 years and 7 years experience in this certain field, what would you say is probably the biggest lesson and take that you kind of experienced and you learned from?
I would say the biggest lesson I've learned in this industry is how important it is to help clients, men and women, and mostly women in this clientele, see their natural beauty. I feel like they want to look in the mirror and just tear themselves apart, and they're not looking at what is making them so uniquely beautiful, you know, and how beautiful it is to look like you and to look different. And that's important for me to share with my clients, that you don't want to look like everyone else. You want to look like you, and that's what makes you unique and stand out, right? And so I think that has been a big lesson, as how many women kind of tear themselves apart, or they have a partner who never tells them that they're beautiful, or is maybe tearing on them as well, and they're already hard on themselves. So coming into our spa and us being able to have a platform to show them the beautiful, you know, parts of themselves, and that, yeah, you look absolutely stunning, but the aging part, you're losing a little volume here, and we can restore that. And, you know, just being able to do those little enhancements that they light up, and it's a great feeling.
Oh,
So.
I love that a lot. I feel this field I'm trying to learn so much, you know, as much as possible, because I feel in many of my podcasts, I've been also interviewing a lot of the mental health issues.
Yes.
Obviously, I've been focusing a lot on the men's side, because women also experience, if not more, anxiety and depressions, and somehow they all have a common denominator, and it's just like the lack of self-worth, you know.
Yes.
I know men,
Self-esteem,
exactly
they compare themselves.
especially with the rise of social media, you know. We've seen a lot of like teenage girls just committing suicide because of the TikTok. They feel like they don't have a significant amount of following. They're not pretty enough.
Yeah.
And it's such a damping to their image and to like their character, and also their confidence as well. So I feel like
Exactly.
something like this enhances and brings the inner and outer beauty of a woman as well. So thank you
Absolutely.
for sharing those stuff. Is there like an age limit that you can perhaps like go to, maybe 18, or do people come younger for these?
So yes, 18 without a parent. We do cleft lips for free. So that is one thing at Snatched Medical Spa that we do. Is I'm always looking for a way to give back, and I love that we have a clientele of cleft lip palate. Do you know cleft lips?
I was about to ask, what the heck is that?
Oh, okay. So it's whenever you're born with like a deformity in your lip, and it's like a hole here. So I don't know if you've ever seen anyone. What is that actor that has it? He was the Joker. And Jaquin.
Joaquin, the most recent Joker.
He actually was born with that.
Interesting.
Yeah, he has a mustache, a lot of facial. But if you look close, he's got a scar. But anyway, there's a lot of that. And so girls, right, this is a big insecurity for them to have that. And so we offer free lip filler once a year for anyone that has a cleft lip. And that it's just like the greatest gift. I mean, Mariah, my assistant's here, and she can tell you they cry and they finally feel confident in that area that they've always looked at and like hated. They can actually like look at it and love what they see. So
I love that. I love that a lot. And speaking of the, confidence and being comfortable as well, the question I actually like that I want to read word for it, it says, what is your approach to patients' consultations and ensuring they feel comfortable in their treatment choices?
So I think really listening to what their concern is.
Okay.
So having them talk to me about the area of their concern. And again, listening to what their concern is, because their concern, might be different than what I initially see. I could look at them and think, oh, they're going to come in and they want, cheek filler. But they may come in and their concern is their lips or something else. So making sure that the client feels heard and giving them the time to talk to you about what their concerns are and why is that a concern for them.
Okay.
And then talking through the different treatments that we offer that could help that area or that concern. And usually I like to give, multiple options that way, any budget that we're working with, we have something that we can do to help you and enhance that area.
Okay. This is going to be a broad question, and there's no wrong answer to us, but I've always had the perception that these treatments are extremely expensive. What would you say is an average price range for maybe a Botox that you work with regarding the treatment?
So depending on your age and depending on if we're doing prevention or correction, I would say it ranges anywhere from $300 and we're just going to talk the upper face, so like $300 to $500 or $600.
Oh, okay.
And that also just depends on like if you're a member, then you get member pricing. If you're not a member, it's going to cost a little bit more and things like that. So.
I really thought it was like in the thousands.
Yeah, and some of the treatments are like lip filler. The average price is going to be $600-$700 for lip filler. That's going to last you a year. And then like the Snatched Jawline is going to be up there. So that one is more expensive. That one starts at $2,600. But you do have to remember that you get the longevity. It's permanent. So it's an investment, but you get the longevity of it.
Okay. And the reason I know it's recurring because when we sold pest control, I'm going to give an example. It'll be like a certain initial fee of maybe $200 for the first treatment where we end up doing the cracks, crevices, we spray 3 feet up, 3 feet out, we go inside, we do the traps, and then every 3 months we end up just going there, just doing the basic treatment like the technicians and so forth. And this occurred for every 3 months till they end up canceling the contract as well. Yeah. Now I want to go to this. We know that this treatment, it's one of those, it requires a lot of maintenance, right?
Yeah.
What happens then, like along the line, like 5 or 6 years down there, and you decide, listen, I want to just kind of stop doing this? Yeah. Are there going to be massive side effects like my face falling apart?
Not at all. It's going to be better that you did it once than not at all.
Okay.
So your aging process, you just kind of slowed it down during those years, and then, your aging process will just pick back up. There's not any side effects from just stopping it. Like even the hyaluronic acid, which is filler. So we have hyaluronic acid already. So it's a synthetic jelly form of hyaluronic acid, and that's what the filler is. Even that is going to just kind of disintegrate over time, just like our bone disintegrates over time. So you won't notice like a major change from stopping. It's just going to slowly wear off.
Awesome, I like that. I'm trying to figure out how I can get this matte rife jawline.
Yeah.
So it's just like
do the Snatched Jawline.
There we go.
And do a teeny bit of chin.
You think it requires that?
Let me see your profile. Just a little. He's doing like this. He's like making it. He's like, hey, you said I need a butt. You're getting a chin. But you're lucky because you've got great cheeks, right? Good full lips.
Oh, stop.
Smooth
Jillian.
forehead.
Stop.
All you need is a little chin.
Ever seen
You're
a black
lucky.
man blush before, Jillian? Stop it.
Oh, making him blush.
How do you stay up to date with the latest techniques and trends within your field as well? How do you guys stay up to date with
So
that?
it's super important to continue education, going to conferences, events, watching the webinars, and it's evolving all the time. And so as a provider, to give your clients the best outcome, you need to make sure that you're up to date with the new technology because it's just getting better and better.
Okay.
So.
Awesome. Another reason why I'm glad you mentioned that, I often feel it's so important to continue to network and grow and uplift your, and continue to educate yourself, especially when you're an expert in your field. With that being said, did you have a mentor that perhaps like was teaching you the ways?
I feel like I had a lot of mentors. I feel like in this industry, you can take pearls from so many people, and it's really important. You may not agree with everything, that they're doing in their way, but there's something you can kind of take away and make your own, right? Because at the end of the day, you are the artist when it comes to filler and bow. It is creating like a sculpture. And so you still want to do it the best way that you're going to be able to get the best outcome. I like to compare it to like an artist that paints. They use different textures of paint, thinner like watercolors. They may use the thicker acrylic paint, and then they have different size paint brushes, right, for different whatever they're trying to create. Same thing at our medical spa. We use different size needles for different areas, and different filler is going to be like different paint choices. So making sure that you're choosing the right. But at the end of the day, what I choose might be different than what my other injector chooses to use, and that's okay, right? Because she's the artist, and this is how she makes her most beautiful creation, and I may do it a little bit different because at the end of the day, it's these hands and these eyes, right, that's creating it.
I love that so much. So your new name to me is going to be Jillian Picasso Brooke.
I love it.
I want to know, I know that safety is such a major concern for clients, that you come across as well. How do you ensure that the procedure is usually safe and effective for them to feel a bit more comfortable with that?
Yeah, so I think it's important to remember that first and foremost, you are a medical provider. You are a nurse. So you need to make sure that you are still using your nursing skills even when you're doing these artistic treatments. So, we're trained on what to look for, adverse situations that may arise. We know how to treat those. So really just kind of, that's when your nursing background really comes into play, is knowing how to handle any kind of adverse situation so that you know how to take care of your client.
Awesome. No, I'm glad. Another thing you mentioned earlier on, you just spoke about the importance of just maintenance and taking care of our body, because I'm obviously, in my belief, I strongly know that our bodies are literally temples of God. So it's not just a one-time thing, but constantly maintaining it and getting the best out of your body as well. So absolutely. I appreciate everything you've shared so far. And then there's a lot of myths, a lot of misconceptions. Are there any of those that you feel like are trending in this field that you're in that you want to try and like just quickly debunk in the field of?
I think not necessarily like debunking, but almost kind of removing the judgment of people that decide to get cosmetic treatments.
Okay.
If you're wanting to restore lost volume, or you're wanting to, correct an area for whatever reason for your own self-confidence, to me, it's no different than someone that chooses to get braces, right? Like, yes, we're born this way. You should, this is what I hear sometimes from other clients. They'll leave like, little messages under a post like, oh, you should love yourself the way you are. You don't need that, and that's okay. And that's their opinion. And I always tell, those people, you definitely don't have to do it if it's not for you. But I want to change the mentality from that stigma to more of like, this is no different than deciding to want to do something different to your hair color, or I want to get braces because I don't want, my teeth to be crooked. We put braces on our kids all the time.
That's true.
And that's not judged, and you wouldn't tell your kid to, oh, well, love your teeth the way they are. Like, you would want their confidence, if that's an area that they're concerned about, then to me, it's that judgment of if you don't want to do it, that's okay, but don't judge other people for their choice in wanting to do those treatments and make them feel bad about it. Mm-hmm. So yeah, I actually had a conversation that you can even find on one of my posts with a lady that was like, she bashed me a little, like, you're trying to make people feel like they need and they should love themselves the way they are. And it ended up being a really good exchange because she never had thought about it that way. Mm-hmm. And I asked her, I'm like, do you get your hair done? Do you put makeup on? Those are all ways that you are choosing to enhance yourself. And I could tell you the same thing. Don't wear makeup. You don't need it. Love yourself the way you are and just go without your hair being done. Do you know what I mean? So 100%. Like, how far are you going to take it? And if it's not for you, that is okay, but don't judge other people for deciding to do what makes them feel better about themselves. And she was actually like she was like, oh, I never thought. So it was a great conversation, really.
Awesome. Now, I'm glad to hear that. I mean, social media has just become a place where people really give their opinion, and sometimes it may come out super aggressive because of the misunderstanding.
Yeah.
And I feel like conversations are so important because sometimes if you fully understand the grassroots or you fully understand what somebody's intention in doing what they're doing and helping women become a better version of themselves and enhancing their true beauty and identity as well.
Yeah, and I do get where she was even coming from because there is so much pressure on women to be perfect and to look perfect. And so I can see from the outside looking in what her overall goal is like, we don't want to have that pressure on women. And I agree with her. And that's why when our clients come into our spot, it's important for us to talk to them about the idea of perfection, right? And I've had some clients like, well, I have a line here and I just want it gone. And I'll say, but do you want to look human? Because humans have lines. And just kind of help it. Like, you don't want to look, like an alien, and you don't want to look like you're having an allergic reaction because you're so puffy.
100%.
You want to still look human, and we have lines, and those are okay, and they're beautiful. And I understand wanting to maybe like soften an area, but just having those kind of conversations and that education to me is really important, especially for the younger girls. I have a lot of younger girls come in, and I think that they just need someone to kind of talk to about it, and then they get a different view on it. So.
No, I really love that as well. I'm glad you covered that. Just to go back to one of the questions that I spoke about when we kind of touched on Kybella as well. Do you have any new projects or new treatments that you're planning on launching in the distant future or like upcoming as well?
Absolutely. So we have a new treatment coming this fall that we're super excited about. So stay tuned. I can't tell you what it is yet.
Can you give us a sneak peek, for goodness sake?
So let's just say it's the latest and the greatest.
Oh my!
And it's a skin treatment. So it's gonna be more for as we age. We get the sunspots and the different kind of aging. So it's gonna really help in that area.
The problem, I'm glad you mentioned that, and a follow up on the skin thing. The problem, I think, as well with social media, with what separates like professionals like you, is that there's a lot of like also fake gurus out there and people that don't have like that specific experience. Because I came across a reel and I was like, I'm not going to forget this thing. A guy. It was actually 3 men. It was actually just men talking about how the new skin condition is taking your own urine, putting it in your face.
No, I don't.
Although
we're not doing that. That's not what it is.
That's just.
Like, how did you know that that's what we were doing? You just blew it.
No, I mean, because I'm like, I was like, I'm gonna save it. I have to ask her maybe towards the end.
I actually seen that too.
You know what I'm saying? It's like, take your urine. And I'm like, I don't like the smell of urine.
No.
Even my own.
Nah.
And like, but I wouldn't like, if it was gonna make me like look like I'm 20 at 60,
Well, I mean, we might be doing it then, but I don't think so.
All right, there we
Yeah.
go. I'm glad you
No.
kind of like, you're not doing the urine part thing.
I'll
so.
debunk that one.
All right, so now I don't think I left anything out. I just have two last questions. If you were to look back, I know this is the most common question people ask in podcasts, but I usually like it because everyone's story is so different. Now, looking back when you were like between Georgia, Florida, and where you're at right now, looking at your younger self selling water for $1, very expensive tap water,
It was
by
a
the way.
nickel.
Oh, okay.
The dollar was the beaded bracelets.
That's a fair price, and thanks for debunking that real quick. Looking back at that whole procedure, what would you tell 5-year-old Jillian? What advice would you give her?
I would just say keep doing what you're doing, stay authentic and true to yourself, and don't let the outside pressure keep you from your true path of who you are, what your passions are, what your overall goals and dreams are. You just keep on moving.
Awesome. I love that so much.
Yeah.
Then the final question we ask all the guests this because our motto is the code to winning, the insights you need today to seize the world tomorrow. In your opinion, there's no right or wrong answer. What is your definition of winning?
So my definition of winning is finding your passion and learning how to make money doing it. That's winning.
Boom. Mic drop for that one. Awesome stuff. All right, Jillian, if you could look at the camera, let the people know where they could get a hold of you. If they want to try and get a consultation, if they want to follow you on social media, just let us know everything where they can find
Absolutely.
you.
So Snatched Aesthetics is located in American Fork, Utah. You can find me on Instagram is really the best way to get in contact with me. I check all of my own DMs. It is Snatched by Jillian Brooke, and I'm excited to meet you all, and hopefully you guys will come in for a free consultation. We do free consultations, so come in and chat. Love it.
The code to winning, insights you need today to seize the world tomorrow. Jillian Brooke, thank you very much.
Absolutely. Thank you.